So the Bougie, or endotracheal tube introducer, is an airway adjunct that has been shown to improve first pass intubation success both in the emergency department and the pre-hospital setting. Here you can see we've got several different brands of Bougies or tracheal tube introducers. And what you'll notice is that there's a variety of shapes here, and that's because the tracheal tube introducer actually holds its shape. It has some memory to it, so as you bend it, it will maintain that shape somewhat. The adult size Bougie will fit through an endotracheal tube size 5.5 or larger, so should be adequate for any adult intubation. Intubation using a Bougie is best performed with an assistant, but this is not required. Here, the paramedic passes the Bougie and then the assistant railroads the endotracheal tube over the Bougie while the paramedic stabilizes the Bougie and holds the airway open with the laryngoscope. You always want to make sure that you're confirming your placement immediately with continuous waveform capnography. If you don't have an assistant available to help with passing the tube over the Bougie, there are a couple of options. You can preload the endotracheal tube onto the Bougie so that once the Bougie is appropriately placed, the endotracheal tube is ready to go. Be sure that if you do this, that the Bougie is inserted to an adequate depth and stabilized while you pass the endotracheal tube to prevent accidental dislodgement. Alternatively, you can place the Bougie and then railroad the tube yourself while stabilizing the Bougie with the hand holding the laryngoscope as shown here. So there's often a tendency to remove the laryngoscope blade as soon as the Bougie is placed. You should avoid this because it makes passing that endotracheal tube really difficult. The soft tissue structures collapse around the Bougie, and you will invariably have to reinsert the laryngoscope to pull the structures out of the way and get that endotracheal tube in place. So it's best to just keep your laryngoscope blade in and then railroad your tube while you have the structures out of the way. While the Bougie is flexible, it still maintains its form, and it's rigid enough that you can damage the trachea if the Bougie is inserted too forcefully. Always take care when using the Bougie, and if you meet resistance, it could mean either that you're in the carina, or it could be that the tip is hung up on the trachea. So if you're in the carina and you're at an adequate depth, you should stop there. But if you feel that you're caught on the tracheal rings, you can pull the Bougie back a couple of centimeters and turn slightly to reorient the curvature before reattempting to advance. Never force the Bougie into place. So the Bougie is really a simple tool that can help improve first pass success for every intubation. Just like any new skill, it takes some practice. So before using it in the field, you'll want to try it out on your airway mannequin and get used to the feel and mechanics of it.